Hi, I'm Yolanda and this is Speak On. Today we're discussing therapy. We've heard people often band around the saying that everyone should be in therapy, but we know it's not accessible to everyone. We know that not everyone understands what it is, and we've heard so much talk on TV about learning more about psychologists, psychotherapists, counselling, etc. But we also know that on TV are the people that qualified? How are they selected? How much study have those psychologists or TV psychologists actually done? And as a result of that, there is some backlash online and people saying therapy is a scam. I don't need therapy. And people are drawing all sorts of crazy conclusions. So today, to help me clear it up and to help me talk about what therapy is and do some myth busting, I'm joined by trainee clinical psychologist Candice Williams and clinical psychologist Dr Haben Ghezai today. Thank you. Oh my God, we got through it. Okay, just for the listeners, I have a cold. I'm on Benylin. I may stumble through this and I will not re-record. So we're just going to go with it. But thank you so much for joining me, Candice and Haben. How are you doing, Haben?
I'm good. Getting through it.
Good. And how about you, Candice?
Yeah, all good, thank you. Plodding along.
Yeah, well, thank you so much because I know that both of you are incredibly busy people. So we're going to go straight into it. So I'm going to go to Haben first. What is a psychologist and what is their role? What do they do? What do you do, essentially?
I always struggle to answer this because I think the term psychologist is such a broad one. And under that umbrella term psychologist, the work we do can sometimes look so different. But in the broadest of senses, a psychologist is a professional that specializes in emotional, mental health, and human behavior. And underneath that really broad umbrella, you can have psychologists that specialize in different areas or different disciplines or different fields, which is then when you get all the distinctions between your occupational psychologists, your forensic psychologists, your clinical psychologists, your counseling psychologists, your health psychologists, because under that really broad umbrella, they've specialized in really specific areas.
Mm-hmm. And what's the importance of knowing the difference between all of these different types of psychologists, especially before talking about them?
Well, I guess the difference would be that, like I said, they've specialized in specific areas. So, for example, if you are wanting someone to help you think about human behavior and health as it pertains to the workplace, then whilst a clinical psychologist may be able to support you with that, an occupational psychologist perhaps may just have a little more expertise in thinking about the area of human behavior within the workplace more specifically. So I guess it's just thinking about where people's expertise lie.
So, Candice, I'm going to go over to you. What damage can come from speaking with underqualified mental health professionals?
That's a really good question. And I suppose I would first off sort of wonder in terms of someone seeking support for their mental health. I think anyone, whether they're qualified and they've perhaps gone through training processes that a clinical psychologist, for example, may have done or not, I think everyone is capable of doing harm in a therapeutic space. I think that's important to name. However, where someone perhaps hasn't gone through a particular sort of training program, then of course, because I suppose, and again, I say of course, it's a massive assumption, but everyone's training route, whether they're a psychotherapist, whether they're a psychologist, they all are sort of made up in different ways, but essentially there is a process of assessment and evaluation of your competency, supervision, someone having clinical oversight over sort of what you're doing, sort of ensuring that your skills are developing in the right area. So I suppose depending on why you're seeking support for your mental health, it's important to be aware of someone's training background, of the specialism that they have, of the therapeutic approach or approaches that they tend to use more, in order to then assess actually whether is this person sitting right for me and sort of what I might need out of therapy. But yeah, essentially when it comes to harm, if you've not gone through sort of a training program dependent on your speciality, then I suppose your likelihood to do unintentional harm is greater. However, as I said, not to say that people who have gone through that route are also not capable of that as well. That's a really long way to answer your question. So I hope that made sense.
Yeah, it did. Thank you. And then Haben, how easy is it for someone with minimal qualifications to offer their services as a psychologist? Because if you were to look around, it just seems like so many people are psychologists now. But then when I've spoken to them, and this just even the process of kind of sourcing people for events and panels, etc. Not everyone that is presented to me, not everyone is created equally, essentially. And some people are like, oh, I'm a psychologist, but they don't really have their qualifications don't really measure up.
Yeah, I guess the reality is that psychologist isn't a protected term. So you could have an undergrad in psychology and call yourself a psychologist. In the same way that, you know, me and Candice can call ourselves psychologists. So it's not a protected term, which means legally you could. I guess the question is, you know, ethically, could you call yourself a psychologist and offer support in the same way, and morally perhaps? So I guess when you're then thinking about what type of psychologist, the question you want to ask is, what are their experiences? What are their qualifications? Who are they registered with? Who are they held accountable by?
I mean, it's scary when you said that. It's like someone that has done an undergraduate kind of degree, or it's like, or they haven't majored in it, essentially, can kind of say that. Yikes. That's really quite frightening. And I was about to say, do you feel that the term psychologist is used incorrectly on TV? I'm going to ask you, Haben.
It's hard to say, I guess, because I think where it's not a protected term, you could call yourself a psychologist and go on there. I guess it can just be really misleading, because I think the general perception is if someone's calling themselves a psychologist, they have a certain level of expertise and qualifications, and that's not always corrected or made more transparent, that when we're calling this person a psychologist, this is what we mean and this is what they're speaking to. So it can be really misleading. But also, you know, having said that, people can go on with the highest qualifications and call themselves a psychologist, but say lots of things that still can, like Candice was saying, that cause harm, that don't sit well with people, that, you know, sit with a world and are with it, that's in a particular worldview that actually doesn't fit with everyone.
Yeah, absolutely. And Candice, like, what kind of impact do you think, like, somebody using the term psychologist incorrectly on TV, what kind of impact can that have?
Well, I suppose, again, it makes me think similar to what Haben mentioned earlier with, like, ethically, obviously people, everyone has their own views and opinions of things, but if you are using that term, then obviously along with it then comes that association with psychology generally that people will take from, you know, for example, if someone is justifying a thought or feeling, they could quite easily say, well, I heard a psychologist say it on TV, and they wouldn't be wrong, because if that person is using that term, as we said, it's not protected psychologist in that way, then that they're not wrong in sort of sharing that information. But I think the tricky part is where that information perhaps is in some way, I suppose, harmful towards people because they've not thought ethically, or they don't have the training or experience that's needed with the practitioner psychologist titles that are protected. That's your tricky part. And I suppose I'm noticing I'm saying that, and actually there is a lot of, I suppose, organisations and acronyms that will get flown around in lots of different places. I think it's important to sort of for everyone to be aware sort of how these organisations work. I imagine we're going to get onto that at some point, but yeah, essentially I think the field of psychology can feel really confusing to all of us, really. I think a lot more could be transparent in some ways when people are sharing views and using that title.
I was going to say, I agree with that, because I think you can still have two people that call themselves psychologists that have very different views and opinions, and could still back that up with, you know, the research they found, and neither of them may be incorrect. It's just actually they're coming from different positions. I guess just going back to Candice's point, so the importance of transparency, and also just when you hear something, fact checking and knowing that just because a psychologist has said this, it doesn't always make it so.
Do you think that people need to be a bit more, like you both said, transparency there? When, for example, if I'm a psychologist on TV, should people kind of say a little bit more? It's like, look, this is this from this understanding of, kind of like flesh that out a little bit more, as opposed to saying, if this has happened to you, just do this. Do you think there needs to be kind of more duty of care in their delivery?
Yeah, I would say there have been times when, I've seen, whether it's to a live TV show or clips that have been shared where someone has perhaps taken that stance of, well, I think like Haben was saying, research shows X, Y, Z. And yeah, research can show X, Y, Z, but it's important to know, okay, who was included in that research study? What was the exclusion criteria from that research study as well, in order to know actually, is this something, this recommendation or this conclusion, is that something that's helpful for me or that could apply to me? But I think the difficulty is that a lot of the time when people might share sort of generalizations around something, it takes, I suppose, to know about how research works in order to know, okay, well, how can I critique this a bit or question it a bit or just be curious about what this might mean? I think it's almost that quest for sort of definitive truth, that sort of positivist kind of aspect of society that can lend itself, unfortunately, to people not perhaps knowing that actually, within psychology, you are meant to critique and you are meant to evaluate research, and that's how the field grows. That's how we develop our knowledge. It's not a case of we have got this knowledge, this is it, and we're not going to develop any further. Do you get what I'm trying to say?
Mm-hmm. I mean, also one thing that we all know that we've learned from recent years is that there are maybe 20% of people in the world that actually know what research is. Because a lot of people say they're doing their own research, but unless you've written a thesis, studied something really specific, written a bunch of dissertations, researched a huge article or whatever else, people don't really understand that what research is. That term is bandied around a lot now. And both of you have mentioned that psychologist isn't a protected term. So Haben, which section of it should be protected? What should people have to have before they can say, I am a psychologist?
Well, where the field of psychology is so broad, it's a little hard to say what they should have depending on where you're specializing. But I would say that if you are looking for a psychologist or professional, the first thing I would probably advise people to do is check out their qualifications, check out to what extent they've studied or what and where they're specializing, but also see where they're registered. I think anyone who's a professional psychologist would have registration. So the same way your doctors are registered with their kind of professional governing body, all psychologists will be registered with the HCPC. And that's kind of widely accessible to everyone and anyone. So you could go onto that website and just select practitioner psychologist and type in the person's surname, and if they're registered, their number would come up. And anyone can do that. So I would just check they're registered, and that tells you that actually they're held accountable to a wider body.
Mm-hmm. Yeah, that makes sense. I mean, just in the same way that if you have a law degree, you can't say you're a lawyer or solicitor, that maybe there needs to be something before or something in that process where it can be kind of like the process where you step over the threshold, as opposed to somebody who maybe did psychology for sixth form or something like that saying that they're a psychologist. And Haben, again, how can TV shows ensure that they're hiring adequately qualified psychologists? Because I mean, as a person in the media, I've seen when people put call outs for people and they're like, we need someone that can come and do X, Y, and Z, and they need to turn up at 4 a.m. or blah blah. They don't ask for anything specific. But how can TV ensure they're doing that so they do have this, I don't know, overall duty of care?
Yeah. I think the same way you would if you were going for a job interview. I would check out their qualifications, check out where they've studied, check out where they're registered, but also know what specialism you want someone to give their expertise on, because even where they are registered and qualified, it doesn't always mean that they will have the expertise to speak to the area you need them to comment or apply wisdom to. So for example, I probably wouldn't be the best person to come and give lots of wisdom and knowledge or advice or speak to on autism, because that's just not my area of special. And I do have some knowledge on it, but it's just not where I've chosen to specialize. So I probably wouldn't be the best person to take on television and speak about autism more generally. And there are loads of other psychologists that are way more qualified than I am to be able to do that. But if you were to then ask about my kind of work experience and where, what my area of expertise is, you would see it's not that area. So I think what the TV and media departments can do is actually just do more thorough checks.
Yeah, absolutely. Because there are, I would say, career TV career psychologists who are wheeled in and out of things because they're going to get paid a fee, and they talk on everything without saying what they specialize in. There are some that are like, okay, this, I can't say this because this is my area, but that's really rare. There are people that genuinely position themselves as that, and on Instagram as kind of almost like psychology influencers as well. And they aren't saying essentially that this is what I specialize in. They're not saying what you just said, essentially. They're just thinking money. And like, I think it's a good point that there should be some more thorough checks, because essentially you can build a database of people that you can contact then who cover those subjects, and it wouldn't be that hard. So talking about just TV and psychology, we're going to take a very small sidestep into, I suppose, the world of reality TV, taking part in shows, and obviously the part that psychologists have to play in that as well. And having had clients that have gone forward through and have been in various reality shows, there are a certain amount of psychological checks that take place. And the reason I bring this up is because I think when people listen to the show, I can imagine these are the questions they'll have as well. But what potential psychological risks can come from taking part in a TV show? What would a psychologist kind of have to look for before letting someone on the show? I'm going to go to Candice.
Yeah, that's a really interesting question. I suppose it depends on the show, I think, is one thing, and sort of perhaps someone's motivation to apply, to take part. I think one sort of thing that psychologists, clinical psychologists in particular, can sort of lend themselves to is sort of having that opportunity to have an in-depth assessment, to go through someone's formulation with them, so do it in a collaborative way, and sort of unpick a bit around sort of what their hopes are for going on the show, perhaps things in their history that's important to know. But I suppose given that sort of reality TV is huge now, when you just think about how much it's evolved over time, a lot of the time when perhaps things have happened where sort of the media have made it difficult for someone and really sort of attack someone's sort of personal character, I think a lot of the time you might see sort of people comment and say, well, surely they know what they were signing up for when they should have realised the risk. But actually that's where your psychologist can come in and start and sort of have a think around. I'm going to use the word risk assessment lightly, because I suppose when I think of risk assessment sort of in mental health, pure sort of mental health service, that holds a different connotation, but essentially it's similar, because you're helping someone figure out sort of anything that might have happened in the past that might impact their emotional state, whether that's during the show, before or after, and sort of just helping have that conversation around also the things that they're hopeful of, or the things that are giving them that motivation moving forward. But yeah, I think it's a really interesting question. I feel like it's a real sort of individual case by case basis as to where someone needs to be in terms of before embarking on that kind of journey and taking part.
Yeah. And Haben, do you think that people can finesse their way through those kind of assessments? Is it easy to spot people that really aren't going to be suited for that? Or can someone just turn up and be like, hi, I'm bubbly, I want to be on TV, this is great?
I honestly could, if I was to be really honest, I couldn't say, having not been through that process of having to do it. So I don't want to speak out of turn. But I think there's an element that sometimes all you have is someone's word and what they are willing to tell you about their history, about their experiences, about their hopes. We're not mind readers. So on one level, all you have is how they're presenting to you in their behavior, their words, their experiences, and what they're willing to give you. And with that, you could draw some fair and reasonable conclusions about how, the show might impact them, or and what their motivations are. But sure, if you are a brilliant actor and you're willing to, I don't know, not tell the whole truth about your experiences or your mental health experiences or your motivations, then perhaps there is an element that you can kind of, finesse your way through. But there are perhaps also sometimes where actually you may be saying one thing, but your whole body language and presence in the room says something different.
Yeah.
And you may be able to draw other conclusions. So it's a little harder to give such a concrete answer to.
We've seen some of the some things that have happened to people that have been on reality TV shows, and we've seen people in the press, the general public, etc., blame these reality TV shows and poor aftercare, etc. I mean, having worked with certain shows and having knowledge of some of that process, I think the aftercare is actually quite good in some of the cases. Can't speak for every show because I haven't been involved with everything, but the ones that I have witnessed, been part of, the aftercare is quite good. And also I feel like sometimes some things are going to happen, that like terrible things are going to happen to people, and there's kind of nothing you can do about it, unfortunately, it feels like. But what can TV shows do as a part of that kind of aftercare package that could help people kind of cope with the aftermath of TV?
I think perhaps maybe a really important thing they could do is just help them think through how they might manage some of the difficulties that might arise as a consequence of coming in the show. I think when you are in the public eye and you have people, you know, on the West End throwing lots of unkind things about you, that can really impact how you view yourself, how you view the world, how your relationship with yourself and others, and perhaps really thinking through, you know, these are some of the potential risks. Let's think through the different ways it might impact you, and what are the ways you could keep yourself safe? What are the ways that you could look after yourself? And really thinking through in advance, perhaps some of the ways you might be able to safeguard yourself from these potential risks should never be taken for granted, so that when you are in that space at the other end, having come out of it, you're not then having to think about, gosh, how do I manage this? But you may already have some ideas, you may already have some systems in place, you might already know where you can go to when you are struggling, you might already have those numbers there, you already have friends that you know you could lean into. It could be really important, as well as the aftercare. So it's thinking about, you know, how do we put up the structures and frameworks in place to support people, knowing that actually there is a reality to the fact that coming out the other end, there could be lots of difficulties.
Yeah, absolutely. I think that kind of, I suppose the open dialogue on social media is starting to make people realize those difficulties, as well as us. I don't know, social media is a double-edged sword at times, isn't it? But I suppose people being more open about their experiences is helping people understand the impact essentially of what being in the public eye can do, and also what that kind of, how social media can also galvanize people that are cruel as well, and what the after effect of that can be.
Just thinking about the safeguards we're putting in place from the beginning, instead of thinking, oh crap, now what can I do? It's always harder to be reactive than it is to be more preventative.
Yeah, absolutely. And so stepping back into our main subject again, as like I said at the top of the show, people throw around, like even I've said it at times, everyone should be in therapy, but I say it flippantly, knowing that not everyone, if therapy and like help for any kind of mental health issues, struggles, etc., I know it's not accessible to everyone. But what forms of therapy are available for those that are struggling? Because the reason why I wanted to do this subject is because I've seen certain conversation in certain parts of social media and things that we posted, etc., where because of potentially TV psychologists, because of there's so much conversation around mental health and sometimes it's a little bit unstructured, there are some people that think, well, I don't know, I don't want to go to someone because I don't think they'll be able to help me, I don't think I'll be able to get help. It's starting to make them feel like therapy is a scam, or they're getting disillusioned by the whole process. But what forms of therapy are available for those that are struggling? And I'm asking that to Candice.
Yeah, there is a lot. There are a lot of different forms of therapy, and I suppose again, dependent on what we might be struggling with, I think the more that we can understand a little bit more about what a therapeutic process might entail, then that might help us sort of make that decision. But I suppose it's just important to say that it's not easy to know every bit of therapy that is out there, and to make that judgment as to whether this could be helpful or not. Sometimes it is about sort of giving it a go and seeing what that's like. And I suppose there was a study, oh gosh, I can't remember who it was by now, that I came across at one point, just thinking about how important the therapeutic alliance is, sort of irrespective of the therapy type. Sort of it's that relationship between therapist and individual that can have an important impact on outcomes, sort of to the same degree. So I think it's I suppose the reason why I'm struggling to answer it is simply because there are so many. But I think the ones that perhaps people might come across more are your CBT, cognitive behavioural therapy. And again, there's lots of different things are linked in as to why that is perhaps the most well known. It's political, it's in terms of thinking about service structures and commissioning. There's so much, I think, around that. But I think in the same way that any of us can go on Google and say, like, what is CBT, there is that information out there in terms of just to unpick what the different types of psychological therapies are. And I suppose alongside that, there are lots of other types of therapies: your occupational therapy, your art therapy, your drama therapy, dance and movement psychotherapy. But I think if to get a sense of that, looking on, say, for example, there's the British Association of Counselling and Psychotherapies. I think that's one website that, again, sort of similar to the HPCP, giving you that sort of list of practitioners. But just I suppose feeling out sort of, because I think that's something that I have found comes up a lot, the difference between counselling and like therapies or psychology. And I think maybe that's a whole other conversation within itself. I suppose my main point is trying to get a sense of, I suppose, how you view like your difficulties. Like, is it something that you feel that some strategies might be helpful, whereby, for example, your approaches like CBT might be helpful, or is it actually I have understood my experiences so far as linked in with the relationships with people around me, with things perhaps have happened in my past, therefore you might be looking at, say, for example, systemic therapy, family therapy, you might be looking at psychodynamic psychotherapy. But sorry, I feel like I've done a really bad job at answering your question, other than to say that there is a lot. And I think it very much depends on how, as an individual, we're making sense of what we've experienced as to what might be the most helpful thing.
Yeah, I mean, you've named so many different types of therapy that I didn't even realise existed. So it's good to know that there are so many different types, so people see it as, I'm going to sit in a room with someone and I'm just going to say how I'm feeling. But knowing that there are different types and different types of approaches, I think it's helpful to know that there is a lot out there. But I suppose also by knowing there's a lot out there can also feel quite daunting as well. Yeah. But so, I mean, goodness, there's so many different forms out there. People obviously kind of know more, I suppose, about talking therapies. It's what's shown to us on TV. It's what we understand therapy to be. So you did bring up a good point, Candice. I'm going to go to Haben to answer this. What is the difference between a counsellor, a psychologist, a psychotherapist, and a psychiatrist?
Okay.
Sorry, that's a really big question.
The fundamental difference between a psychiatrist and everyone else you just mentioned, so your psychotherapist, your counselling psychologist, and your clinical psychologist, is that your psychiatrist specialises in pharmaceutical medicine, drugs, prescriptions, and that's their specialism. So they will focus on diagnosis and treatment through the pharmacological route, medication. That's where you get your antidepressants, your antipsychotics, etc. Some psychiatrists have then gone on to do further training. Some go on to do further psychotherapy training. So then that gives them the scope to prescribe medication and do some talking therapies, because they've got those extra qualifications. Okay. And that's because they're then wearing their psychotherapist hats.
Yeah.
If that makes sense. So then the difference between, so then your counselling psychologist, your clinical psychologist, your psychotherapist, essentially all do talking therapies. What's the difference between a counselling psychologist and a clinical psychologist? We'll all do talking therapies, but what makes a clinical psychologist slightly different is that through our training, we're also trained in things like cognitive assessments, working with autism, and in kind of neuro rehab, which counselling psychologists wouldn't specialise in. But essentially we all will do talking therapies.
Okay.
So there might be minimal differences there. So I guess but a clinical psychologist can then go into different areas because they've had that training in those different neuro areas, for example.
I see.
And then with psychotherapists, their training is also different. So with a psychotherapist, that's still really broad as well, because you get your psychoanalytical psychotherapist, your systemic psychotherapist, and essentially they all do talking therapies, but what then differentiates them is the model they're essentially working within. So your systemic psychotherapists specialize in relationships. They work with families, couples, systems, and the relationships in between them, while a psychoanalyst, for example, will work with the person, their past experiences, relationships, attachments, and with the individual.
And then to Candice, this question. So I've seen before, like, people can do like a course to become a counsellor, but without any of the other stuff. Is that a separate thing altogether when someone is just like a counsellor? Can they be a counsellor without being a psychologist?
Yeah, essentially.
Okay.
Yeah, so I think I mentioned, and I don't know if I even got the name of the website right, but in the same way that registered psychologists are sort of on, you're able to look that up and sort of get their membership number, their PIN number. Counselling also has its own space and sort of website that you're able to do that, and you're able to go through that process of checking out where perhaps someone trained or the areas of specialism that they might have. But essentially, yeah, you can do a course in counselling and specialise in a particular area. So like you can be an integrative counsellor, you can be a psychodynamic counsellor, and I'm sure there's way more than two, but they've completely gone out my head. But yeah, you can specialise in that. But again, I think it's important for any of us, and we're embarking on sort of, is it psychology I need or counsellor I need, is to have a look on those websites, get a bit of a feel for what that might entail.
Yeah, that makes sense. Yeah. And so what should we be looking for when we're looking for someone to help us with this? And obviously you've talked about the sites and where we can find people's like qualifications, but let's say I've started a session. What am I looking for to know that I found a good person?
I think it goes back to what I said in the beginning. So, how listened to do you feel? Are they attentive to you? Are they able to make you feel safe in this space? Because essentially you're not going to open up if you don't feel safe and listened to and heard. And I think all of those things perhaps don't come because they have a sign on their head, but come in those kind of early starts of those conversations and those relationships. How able are you to feel like you can open up? And that might not come within the first couple of minutes, but by the end of the session, do you feel like they've genuinely listened and that they care for you and that they are listening and want to make a difference? And all of those things, I think, could be signs of a really good psychologist. But actually, if you go in there and actually you feel on edge, you don't feel like you're really being listened to, you feel there are strong power dynamics in the room, those might be signs that actually this isn't going to be such a useful space. If you are going down the private route, most psychologists and psychotherapists will usually, maybe not everyone, but would usually give you like a 15-minute telephone consultation that gives you an opportunity to just ask those questions on the phone around how do you work, what are your expertise, how able am I to give feedback? And it'll give you those opportunities to ask those questions and at least get a little sense of what they are like over the telephone, if that's how the consultation is taking place. Obviously that's a little different and harder if you're going down, for example, the NHS route. I don't think you have the flexibility to pick and choose as much as you do, but I would definitely say if you are in therapy within NHS services and you are really struggling, I would say raise it. You do have a right to say, actually, I'm really struggling with this therapist or professional. I don't feel able to express myself or speak. And I really would like a different one. And that may come with having to wait a little longer for someone else to be allocated to you.
I see.
So it does come with that aspect in terms, especially where the NHS nowadays is a lot more stretched. But I think you do have that flexibility. So for example, in the psychosis service I work at, we did have someone who said, actually, I really want a person of colour because I just feel like they'll understand me a lot more. And where that was possible, that isn't always possible, but where that was possible, then we were able to say, okay, let's make sure that the person who sees this person next is a person of colour. And that's not to say that a person, a white therapist wouldn't have been just as good, but obviously there was something there that made them feel, actually, I would feel a lot more comfortable talking about my experiences to someone who might be able to empathise to some degree.
I mean, that was brilliant because you've also touched on, I suppose you kind of showed us like what are the signs essentially that may make you think, okay, it might be time to move on. Let's say I'm not particularly happy with the service that I'm getting for whatever reason. I'm not vibing, it's not clicking, it's not right for me. How do I communicate that to my counsellor, psychologist, etc.? How do I say that? Because that can actually be quite scary. It could be a post-it saying it's not you, it's me, and then you just never go back. That could be one approach.
I would always say just talk to your therapist, because actually what you might find is actually maybe there was a rupture somewhere along the lines, and because you've not spoken about it, it stayed there. And I would say, any good therapist would always be open to hearing your opinion and your feedback and wanting to make sure you do feel comfortable. So I think if difficulties do arise in that relationship, I think, raise it, speak about it, because actually what you might find is that in speaking about it, you're able to repair it, and you may not then need to break up, because actually you find it shifts things in the relationship. And you're able to repair whatever was ruptured, and you're able to then move forward.
Yeah.
I appreciate that's not always the most comfortable either as well.
Yeah. And so, like, to follow on from that, Haben, so if I've now broken up with my previous psychologist, and I'm going to try it again, I'm going to go to someone else because I still need help. How do I trust and open up to that new person, knowing that I've had that experience? It's like, how can people move past that? And is that something they need to communicate to their new psychologist? Like, I was working with this person, it didn't work out. Like, how does that whole process, or how can that whole process work with someone?
I think sometimes a therapist may ask, what is your experience of therapy? Have you had therapy before? What did you have it for? And that forms part of your kind of assessment process. So often the opening might come by the therapist, the psychologist, the counselor asking those questions, which give you the opportunity to say, yes, I've had it before. This is my experience of it. But what would be really important is to really have to think about why it didn't feel right for you. Because if you then perhaps articulate why it didn't quite feel right, you're in a better position to then voice that and help the therapist think about different ways that could be negotiated, navigated, and avoided in the new therapy space. But perhaps if you're then keeping quiet about it, you risk stepping into those same patterns. So I would definitely say voice it, say it often, in the questions asked. And if that question isn't asked, perhaps you can just start by saying, I've actually had therapy before. And often, the one thing I think any professional in talking therapies does is we ask lots of questions. So often questions will follow.
Yeah. Okay, that's
Yeah,
good to
and
know.
I think, sorry, I just wanted to add to that sort of, it's also that opportunity for us going into that space to also have questions asked sort of us at the same time to get a feel for, and that might open up some of those conversations around things that have been helpful or unhelpful in the past. I think, yeah, I suppose just knowing that as someone embarking on therapy, we can also sort of ask, as much as we will get questions put our way, we can also ask questions back, so we're able to get a feel for what processes might lay ahead, or different things that we might need to think about moving forward.
Brilliant. So I think my final question to both of you, I'll go to Candice first and Haben. Should everyone be in therapy? Does therapy work for everyone? Sorry, hard question. I'm going to go to Candice first and then Haben to follow.
Yeah, thanks for that. If I'm going to be honest in terms of what we have definitely touched upon today is that therapy is like a huge umbrella term for lots and lots of different things. So essentially, I would say not necessarily. So it very much depends on the individual. I think to say that any one type of therapy or one type of support is helpful or isn't helpful, I don't think would be fair on I think just us as human beings, and thinking about ways that we cope with distress day in, day out. I think, yeah, it wouldn't be for everyone necessarily. And alongside that, things shift over time. So it might be that actually today I'm thinking that starting a piece of therapeutic work would be helpful, but in a few months' time, a few years' time, I might not need that. So yeah, I think it's fluid. Relationship with therapies or what you feel you need in any given moment is fluid. So
I'm probably doing myself out of a job here, isn't it? But I definitely say no. I echo what Candice said. I don't think everyone should be in therapy. I think, therapy in itself is such a Western concept. And if we think back to other parts of the world where therapy isn't a thing, people have other forms of healing and managing their emotional well-being. They might find and that might be through spirituality and faith, that might be through community groups, that might be through exercise. There are so many other forms of support and healing and therapy is just one of those routes as opposed to the only route. So I think everybody should have a form of support, a framework of support, and something that provides kind of emotional healing, a space to reflect, a space to think, take cognitive audit. But I don't think therapy is the only place that can happen.
Mm. Yeah, the reason I asked that question is because it is something that's bandied around all the time. And I remember even I've flippantly said it before, everyone should be, but what I really meant when I said it was like, everyone should get support when they need it. That is really what it kind of boils down to, doesn't it? But I love what you were saying there, Haben, because in other parts of the world, therapy is a kind of a Western concept, essentially, isn't it? It's normalized in specific parts of the world. And there are other therapeutic practices that exist as a part of a cultural framework for someone else. And that is something that is definitely something that should be explored more, talked about more, and should be understood as well. Because there are, I can imagine, I think I just saw somebody talking about this on Instagram, and they were talking about some things were recommended to them, like kind of different types of therapies and community groups, etc. And then she had pointed out that I was like, oh, that actually already happens as part of my culture. That's literally just how I live my life. And it was almost being, her culture was almost being like prescribed to her in a really specific way. But I think that's actually a show for another time as well. I really like the idea of touching
I think
that.
even, for example, if you think of mindfulness, and mindfulness is something that has really been incorporated into kind of Western models of therapy. And I could name a few like CBT or acceptance and commitment therapy, which have really integrated mindfulness into how therapy is delivered. But if we really think about where, mindfulness has come from, it came from, Buddhist and Hindu practices. Forgive me if I've got that wrong, but, it has spiritual roots where they were doing this as part of their spiritual and emotional, practices. And it was then detached from the spiritual roots, put into a really kind of scientific framework and said, this is really important and this is part of therapy. And suddenly now everybody must have therapy. So I think there are so many practices that already exist, exactly like you said, outside of the therapy world that we can do to look after our emotional well-being. But perhaps where those are slightly harder to connect to, where you don't have that support and framework, where, things have got to a point where you're really struggling, or perhaps because actually you would just rather talk to a professional who's slightly detached, who has a little bit more expertise, who's not within your family or friendship group, then, therapy could be really useful in those aspects.
Yeah.
Just to say, if anybody did want therapy but can't go down the private route, the first point of call is always their GP. I find people don't always know this, so you can just go to your GP and request talking therapies, and they can refer you to something called IAPT, which stands for Increasing Access to Psychological Therapies, where you see a therapist, and it wouldn't necessarily be a psychotherapist or a clinical psychologist, but they will be individuals who are trained to a certain level to offer talking therapies. And that would be, and you be given a set number of sessions, and you can often also self-refer if you wanted to by going onto the IAPT website, because we appreciate being able to get private therapy. It's quite a privilege and a luxury that isn't always readily available to everyone.
Absolutely, especially after the past few years when everything is incredibly difficult.
And there's so many charities out there as well, like mine, that might not offer talking therapies, but offer other forms of support and spaces to talk and connect to other people. So go to your GP and you can get support via the NHS, but also check out charities in your local area, and mine might be a really useful starting point.
Similar to your point, Haben, around like IAPT, but even like even before sort of reaching out to anyone, I think there is a lot of information available, sort of self-help guides and things online that we can read through ourselves and just get a sense of understanding our experiences. And although I appreciate there's also a risk that perhaps comes with Googling things and perhaps thinking, oh, I've definitely got this thing that's in air quotes wrong with me. But I think it's not to underestimate the power of what it might mean to either read about other people's stories who have perhaps gone through similar things, or get a sense of, even say if we're struggling with our sleep. And I think a lot of the time that can be missed when thinking about our well-being, but even just getting a sense of, okay, what are some good tips that I can sleep a bit better. It's those, just I suppose, finding out some things that work for us. They may already be things that we do day to day, but perhaps seeing it presented in a way that is sort of well-being sort of informed, that might just help with our own process and our own journey, knowing that there are things that we can all do day to day to care for ourselves, and it doesn't have to necessarily sit within this package of therapy. Because I think we really tapped into some interesting conversations today, which again could lead on to other podcasts around, who has decided what therapy is, but just knowing that us as human beings, we have so much potential to support ourselves. So also not to underestimate what that might look like at different times.
Thank you so much for joining me today, Haben and Candice, and taking the time out of your day. Where would you like to be found online? I always ask people, would you like to be found? Because some people just want to be left alone to live their lives. Candice, where would you like to be found online?
I've got a Twitter page. I don't think it's that exciting, to be honest. But I mainly post about what it means to be a trainee clinical psychologist at the moment, and share just general psychology related things and connect with people. So yeah, I wouldn't mind if anyone was interested, but equally, no pressure either.
Yeah, that's right. Tell us, what's your handle?
I think it's at Can45. That's what I want to say it is. Feel free to look it up yourself, Landa.
Yeah, I will do that. We'll add it into the show notes. And you also do have you have a psychologist podcast as well, don't you? So where can people find more information about your podcast?
That's also on Twitter. That is Life in the Labyrinth, but I don't know the handle. I think it's linked to my page, but that is essentially me and one of my colleagues chatting away about what it means to be a parent and a trainee clinical psychologist, which is interesting within itself. So I won't, no spoilers.
But yeah, we'll put all that in the show notes. And Haben, where would you like to be found online?
I was really lucky because you asked Candice first, which gave me time to go onto Instagram and actually find out what my handle was. Because I was like, I do not remember what my handle is at all. So Candice, don't worry, like I'm right there with you. I've just had time to search it. That's the only difference. I'm on I am on Twitter, but I barely use it. But I am on Instagram also, and it's at Dr Haben _Ghezai.
Brilliant. Thank you so much. I really appreciate it. Again, I really appreciate you taking the time out, and I'm really looking forward to speaking to you more in the future. Thank you.
Thank you.
Thank you for listening to Speak On. Make sure you like, subscribe, and share with your friends, family, co-workers, strangers in the street. To find out more about us, including our upcoming events, head over to Instagram, instagram.com/speakon_. Bye!